Hi, it's June 4th, 2024, about 9:30 or 10 a.m. My name is Evan Powell, and I have ocular melanoma. Yesterday I had plaque therapy or brachytherapy to place a radiation plaque on my right eye tumor. And 4 times a day I have to add eye drops, medicated eye drops, to keep it from getting infected. So this is my first drop for this morning. And hopefully it looks pretty good. I haven't had too many issues at all. Very little pain. Surprisingly, very little discomfort. I can't feel the plaque. Some people have asked me online if I could feel the plaque. I cannot feel it. In fact, all I can really feel is if I move my eye rather than turning my head. I feel like there's a stitch in there scratching, which is a little uncomfortable, but overall it's been pretty smooth and not too bad. So my wife's gonna add my drops and clean my eye for me, and see how this goes. So this is drop number 5, actually. When she gets it open, I'm gonna ask her to hold my eyelid down and take a picture, and I'll put it on. I'll post it. So, not much blood. That's good on the bandage. Doesn't look like it's too swollen. I can see light coming through. I can't open my upper eyelid though at all. I haven't been able to since the surgery. So,
ready, honey?
Yeah.
Tell me if that hurts.
Oh, yeah, you're pushing. Yeah, that hurts real bad.
I think I'm gonna have to use a Q-tip to get that out. If there's any pressure.
Well, I don't think it's hurt. It doesn't. It's not going to hurt anything if it stays with it. Or am I just cleaning it up for vanity purposes? Or
No.
There's a little bit of dried blood in the corner of my eye. We were hoping to try to get out, but I just don't want to chance anything. I don't think it's that big of a deal. I don't know if you can see it out there in the corner of my eye. But it's just dry blood from the first patch had quite a bit of blood on it, but that was right after the surgery. So if you see that it's kind of a little bit bloody here, and it's been draining here and running down my face, and I usually just dab it dry. But it's not that I'm not being clean. It's just that I'm worried about getting too close to my eye right now. I'm still like hypersensitive about doing anything that's gonna cause swelling or discomfort or anything else. So I got up this morning and had a little breakfast. I'm in pretty good spirits. I have a lot of friends. Huh?
I'm gonna change that top dressing.
I have a lot of friends on Facebook who are going through or have gone through the same ordeal, which is a lot of help because I can ask questions and they know what I'm going through. They know what I'm going to go through. and they're willing to share, you know, their suggestions and how it went for them, and it's so valuable. Because when you're facing the uncertain, you know, even surgery, any kind of surgery is just what's going to happen and what's going to happen afterwards. And it's nice to talk to other patients sometimes, but when you have eye cancer, it's so rare that I feel very fortunate that there's such a large ocular melanoma community to support each other. There are several organizations that are really doing a lot for ocular melanoma research and treatment and patient care. It's like a network of angels. And one is right beside me. My wife is a true angel, being the best caregiver a person could ask for. I love her so much. But that's it. I got to do that 4 times a day. And I'm just making a short video every day with it. And maybe what I'll start doing, I've just been rambling a little bit with no focus. The drop takes obviously 5 to 6 minutes. So I'm going to try to write down a few things that I can talk about for 3 or 4 minutes and cut these videos down to like 10 minutes long. That way people can get through them without getting bored and hearing me ramble. But I appreciate you watching. I appreciate you tuning in. I appreciate you following my channel, liking my channel. Please like the videos. If you can, if you have anything, add a comment. I appreciate it, but I know that other viewers will appreciate it. And just let people know that I'm here. You can go to Through Evan's Eye on YouTube and on Facebook and the other social media platforms. That's my personal journey, where I document my personal journey for other ocular melanoma patients. I'm very early in my journey, but I've learned so much from the veterans and the superheroes that suffer from this rare disease. I think of them every day. I pray for them every day. I keep them in my thoughts every day. There's people running through my head right now. I appreciate you all, and I love you all. Please encourage everyone you know to get a dilated eye exam. That's my mission. Know your eyes, because they see everything. I love you all. Have a good day.